We're transitioning into our next talk by Dr. Joel Castra. We welcome you here, ma'am.
Thank you.
So I'd like to briefly introduce Dr. Castra to the audience. Dr. Castra is an occupational therapist and a psychophysiological researcher who acquired her PhD in occupation and rehabilitation science from Colorado State University. Dr. Castra's research focuses on examining the relationship between attention and sensory processing in children and young adults with autism spectrum disorders using neuroimaging tools such as electroencephalography, or commonly known as EEG, and functional magnetic resonance imaging, for short known as fMRI. Additionally, Dr. Castra also works with children with traumatic brain injury, sports-related concussions, and attention deficit hyperactivity disorder, or commonly known as ADHD. She is also the recipient of the Young Scientist Award for a poster presented at the American Occupational Therapy Conference. We're really excited to have you here and a talk on bridging the gaps between neuroscience research in everyday practice. I personally think that it's a very relevant topic, and I look forward to your talk, ma'am. I invite you to take over the platform.
Thank you. Okay. Hopefully you're able to see my screen okay.
Yeah, it's completely fine.
Okay. So my name is Joel Crasta, and I'm an assistant professor in occupational therapy at Ohio State University right now. Today I'll be talking a little bit about my career trajectory, how I landed up through these different steps. I'll talk about occupational therapy, my research in EEG, specifically in children with autism, and how through this research, trying to bridge the gap between neuroscience and occupational therapy, between research and practice. And then I'll end with some tips and tricks for a career in neuroscience for the younger folks here. Okay, so I started, I was born and raised in Mumbai, India. I did occupational therapy in CMC Bangalore. And it was when I was in CMC that I really got interested in research. I got my bachelor's in occupational therapy, worked with children with autism during clinical rotations. And that's when all these questions began popping up, questions that we didn't have answers for. And so to get those answers, I came to Colorado State University to do my master's and my PhD with a neuroscientist and an occupational therapist. And then from there, to really get into the neuroscience of things, I got a postdoctoral fellowship at Johns Hopkins. They decided to use my face, so I'm deciding to use that to showcase that some very intense research presentations at Hopkins. And then now I am at Ohio State University, where I'm really teaching, but also focusing on research, really bridging that clinical practice and neuroscience. Okay, so I am an occupational therapist, and in occupational therapy, we really help individuals with disabilities, and even individuals who don't have an overt disability, but who may have difficulties in doing daily functioning tasks. So, for example, if someone is not able to, brush their teeth for whatever reason, or not able to get out of bed and go on with their daily life as usual, these are some areas where occupational therapy can work. My research specifically focuses on children with autism. Now, in children with autism, they may not have an overt physical disability. So, if you just look at these children, for example, if they're across the street and are crossing the road, you wouldn't be able to identify them as someone with a disability just by their physical appearance. But children with autism have a lot of other, cognitive and social communicative issues that really need help so that they can function more better in society. And occupational therapy is an evidence-based, science-driven profession, but there is a real need for more research to guide some of the therapies we do. Um, and when I was working as an OT, I got particularly interested in working with children with autism. Now, children with autism have a lot of different symptoms, signs and symptoms. So some of them include inappropriate playing with toys, inability to relate to others. So sometimes a child with autism may be in their own world. Um, they may not be able to socially communicate with other children and socialize the same way. They may have inappropriate behavioral symptoms. They may have hyperactivity, or they may not be as active as some other children. They have some repetitive behaviors. They also have difficulties dealing with changes to routines. Um, they Another very common core feature is language skills, poor speech or lack of speech, and then there's lack of awareness of danger. And then one important focus for me specifically was uh, overreactivity, oversensitivity to sound. Um, and not just sound, there are a lot of different sensory information processing that is impaired in autism, but sound is one of the most commonly affected domain. And uh, oversensitivity to sound is something that is really um, bothersome for children with autism and for their parents. And that was something that really um, uh, motivated me to identify why are these children having these issues. So if you Google search, child with autism, one of the images that shows up is this child covering their ears. And that is because children with autism, they have difficulty in processing sounds. And so sometimes even simple sounds, like sounds of people talking or sounds of a grocery store, might be too overwhelming for these children. And then that's why they close their ears to otherwise sounds which are not disturbing to us. And I really wanted to know, why does this happen? So is this because the child, is being naughty, or the child is having some behavioral problems, or is there something different in how the brain processes these sounds? So why do children with autism have sensory processing issues? Was my clinical problem that came out of my interaction with these children as an occupational therapist during my bachelor's. And so I started some research back in my bachelor's looking at sensory processing in autism, and really got interested in trying to solve this clinical problem. So now a little, introduction to the spectrum of research. So there is basic research. So most of the talks that you've heard so far have been more basic research. We are really trying to identify biological structures, pathways, physiology of disease states, and you're trying to develop technologies to either measure or alter these biological systems. So when you're looking at chemicals and signals, that's considered basic science. And then there's translational science, wherein you're using some of the principles in basic science to apply them to study humans. So you're going beyond studying cells and molecules to um, studying clinical application of some of those findings from basic science. And you're testing those applications in preclinical models. So this is the first step to translation. And then the next step is when you're testing these interventions and technologies that have come so far in larger clinical trials. And then finally, in that translational research spectrum, you are using everything that you've learned so far to clinical practice. So you're taking basic science findings, you're taking your initial translation findings and helping inform clinical practice. You're generating effectiveness studies, you're generating clinical guidelines. So my research question was, why do children with autism have sensory processing issues? And I wanted to answer this question using neuroscience tools. So if Shreya, you can start the first poll, and then you can stop the poll when you think you have enough people.
Yes, ma'am. We'll start the poll now.
Yeah. So the question basically is, if you are doing research trying to solve this problem, why do children with autism have sensory processing issues? Why does a child with autism close their ears? And you're using, neuroscience tools. Where does this research lie? Where on the spectrum does this research lie? So I just want to know, what are your thoughts? So just the first question.
I request everyone to give your responses for the first query. We can add in the second question poll results as well later on in the slides.
Yeah.
As
So
slides.
just the first question. So the clinical question is, why do children with autism have sensory processing issues? And what would you use to answer? What kind of research would you use to answer that question? So we'll. Oh, is it not allowing you? Okay, you can just put something for the second question and then submit it, and then we'll just redo the same poll again. Okay, I think for the purposes of time, let me see if I can end this poll. Okay, so for the first question, most of you said translation to humans, and I think that's exactly where the research lies. So basic science would have been really understanding what those neuroscience principles are, how do how does the brain process information, and then translation to humans is when we're really looking at trying to answer this question. So I'll talk a little bit more about what I used to answer that question. So the first, I started at Colorado State University looking at using EEG. So we use electroencephalography, or EEG, to study sensory processing. And so when you do an EEG, you put on sensors on the scalp, some on the face, but mostly most of the sensors are on the scalp. And these scalp sensors, they are superficial on the scalp. So they're not really, they're only touching your scalp. They're not in any way invasive. And what these do is these sensors pick up the electrical activity generated on the scalp. And so when there is information processing going on in the brain, there's a lot of electrical conduction, and these sensors are able to pick that up through the scalp. And they're very minute, but each of these waves have different properties. So the more slower waves, delta waves, are sleep waves. They are, they usually found when you're in deep sleep. Then you have a slightly more faster wave, that's 4 to 8 hertz, which is when you're in deep meditation, dreaming. When you have alpha waves, which is when you're relaxed, when you're calm, even when you are, and then when you're alert and conscious, you have more of the beta waves, that's 15 to 30 hertz. And then there are even faster waves called gamma waves, that's beyond 30 to 80 hertz. And so each of these waves tells us different things about what's happening in the brain. And we're able to identify how brain processing looks like in different individuals. And so we're able to collect EEG data even in children. Some of this is a kid came into our lab to participate. And so we put on these sensors, we put on a cap which holds these sensors in place, and we get data. And so this is our lab setup in Colorado. We had a sound booth because we're interested in looking at sound processing. this is our setup, and this was in Colorado State. Okay, so a little more about EEG now. This is again, this is how the setup looks for children. We have children wearing a cap. Children are usually watching a computer screen to really focus their attention. And they also have earphones on and they're listening to different sounds. And while they're listening to these sounds, what we get is you know, electrical activity of the scalp. And so the CZ here just refers to like a central site in the scalp. And electrical activity doesn't, EEG doesn't tell us where information is happening, but it tells us in real time, so right at that moment, when what happens. So it doesn't tell us where things are happening, but it tells us when it's happening. And we're able to get, we're able to transform these otherwise quickly lines into meaningful information by doing, a little complex mathematical averaging that allows us to look at what the brain does when it listens to a particular sound. So this is my research looking, the very first research question that we had was, is sound processing different in children with autism? So what we did was we had two groups of people. We had typical children and children with autism. These were children who were between 6 to 12 years of age. We had two sounds, and these sounds were very simple sounds. They were just two click sounds. So just two click sounds like this, 500 milliseconds apart. So you hear one click sound, and then after 500 milliseconds, so that's half a second, you hear another sound. So in 1 second, you heard these two sounds. And so I'll just explain this figure a little bit. On the x-axis here, you have time in milliseconds. Time 0 is when they've heard the sound. The black line is the first sound, and the red line is the second sound. We've just superimposed all of that. And the first graph here is an average of brain activity for typical children, and this graph down here is average of brain activity for children with autism. And again, the black line here is the first sound. And so at around 50 milliseconds after information has entered your brain, so time 0 is when you hear the sound, 50 milliseconds into that, your brain has this large positive peak. And this peak is called the P50, P because it's positive, 50 because it occurs around 50 milliseconds. And this peak tells you that the child is now paying attention to that sound, that your brain has realized something important has come in and it's paying attention. And then after 100 milliseconds, you have a negative dip. This is again related to attention. The brain is now devoting resources to it. But after that, after 100 milliseconds, the brain realizes that this is really very simple sounds. You don't really have to do anything, just sitting and listening to it. So the brain dismisses these sounds. There's no more processing after that. Now, there's a reason why the first click is large and the second click is small. That's because when the first click comes in, your brain is really paying attention to that click. And the second click is the exact same sound within half a second. So your brain realizes that this is nothing new, and so it has a smaller response to it. A clinical example of this is, or a practical example of this is when you go into a coffee shop and you hear music playing in the background. Your brain first recognizes, yes, there's music in the background, but as soon as you go to order, that background sound is filtered out and you're able to focus on your conversation. And this ability of your brain to filter out information that's not required or that's redundant, it's not meaningful right now, is called gating or filtering out. And in typical children, you can see that happens very easily, very automatically. Within the first 50 to 100 milliseconds, typical children are able to have a large response to the first click and a much smaller response to the second click. Now, in children with autism, we didn't see that same pattern. The initial hypothesis was that children with autism have oversensitivity to sound, so they would have much larger responses to both the first and the second click. But what we found is that the brain is not paying attention to these sounds. So the first 100 milliseconds, a lot of this processing is automatic. So this is before you consciously realize, oh, I've heard a sound. Your brain is automatically trying to process these sounds and trying to make sense of it. And in children with autism, these automatic processes are not in place. And so this really told us that more than just difficulties in filtering out sounds, these children have have some real issues in automatic detection of sounds associated with the brain paying attention to these sounds. So this P50 component here is really your brain's ability to pay attention to sounds automatically, and that we saw was missing in children with autism. And then we did a second study wherein we looked at a different method to really see what's happening. And so here you have different EEG frequencies. So when I showed you those different frequency waves, I said between 13 to 30 is your beta, that's when you're alert and active. And again, this is time in milliseconds. At 0 is the first sound, and 500 milliseconds later, or half a second later, the second sound. And so within the first 1 second, you're hearing 2 click sounds. And what happens is in typical children, within the first 100 milliseconds, you have this large red, so this red blob here is this attention response to the sound. And then the second click, because again, it's the exact same information, you have a response. So the blue is when there's less activity, the red is more activity. And so there's less activity compared to the first click, but more activity, or there is some response to the second click here. But in children with autism, you don't see that same level of attention to the sound. So you don't see the same red high intensity processing that we see in typical children. You don't see that for the first sound, you don't see that for the second sound. So what this really tells us, in children with autism, they're not really paying attention to the sound. The brain automatically is not doing what it needs to do. So this really told us that attention is a major issue in children with autism, and that some of the sensory processing issues that is associated with sound processing and even some of the other senses are really associated with the brain's inability to focus on attention. And then for my PhD, we really delved more into looking at attention. So this is, again, the same time frequency plot, but now we had 4 groups. So we had a group of typical children and children with autism. So the ASD stands for Autism Spectrum Disorders. And the typical group, we had children who were not paying attention and then children who were paying attention. And then same way for the autism group, we collected data with the children who were not paying attention, and we collected sound data with the children who were paying attention when they were asked to pay attention. And we asked them to pay attention by pressing buttons to the click sound. So again, they heard the same 2 clicks, simple 2 clicks. In the passive condition, when they were not paying attention, we just asked them to continue staring at the computer screen, and that they'll hear some sounds, but they can just ignore those sounds. And then the active condition, now we asked them to press a button every time they heard a sound. So they were really asked to focus their attention on the sounds. And what we found was, all the children with autism were able to press a button fine. They didn't have any behavioral issues. So they were actually paying attention. And we found that their brain processing looked more neurotypical when they were paying attention compared to when they were not paying attention. And so again, click 1, click 2 in the neurotypical group, and in the autism group, the brain processing in general looks very different. But when they were actually paying attention, the brain processing looked more similar than when they were not paying attention. So when they were not paying attention, they had more activity going on, more disorganized activity. But when they were paying attention, they had more organized activity. So coming to the main clinical question of sensory processing issues, we showed that children with autism have differences in automatic brain processing. That the reason children with autism are closing their ears is not because the child is just wanting to have behavioral problems, or the child is not wanting to listen to what the mother is saying, but it's because the brain is not able to pay attention to important sounds. And this inability to automatically process information leads to an overload at later stages of processing, which is what causes this overload, and the children then just close their ears because they're not able to make sense of it. We also found that these sensory issues with closing their ears are actually associated with the brain's ability to pay attention. And we found that children who have better attention have better sensory processing. And so, if you when I've shown you very small sample of my research, but overall, what this research said is that if you train children to pay attention, you will help them process sensory information better. So our next step in the research is now really looking at attention training in autism. So we've taken some of this more basic finding and now you're moving towards attention training. So going back to OT, as an OT, we do a lot of attention training in regular therapy, but our focus for children with autism has always been on the sensory processing rather than on the attention. And what the research has showed so far is that we really need to train attention. And when we train attention, we will be able to improve sensory processing. So instead of focusing on the more higher levels, we really need to focus on these fundamental levels. And if at the fundamental level we're able to improve attention, we may be able to improve sensory processing. And if we're able to improve sensory processing of simple sounds, then we may be able to improve language and communication. Now, just think about this in terms of clinical relevance. These are children who are in the lab, who are in a very controlled environment, and have difficulty processing simple click sounds. Now, imagine the same child in a grocery store, in a crowded street, at a birthday party, where there are so many different sounds, so many different lights, and other experiences and contexts and people. And imagine the brain's ability to process all of this information at the same time when even simple sounds is challenging. And some of the processing that is automatic for us that we don't even have to think about are not in place in these children with autism. So when you take some of these rather basic findings into more clinical situations, you realize how much more challenging it is for a child with autism, um, in everyday practice. And so the goal right now is my current research is we're looking at how we can improve attention in occupational therapy for children with autism, and how does brain processing look pre and post this attention training. So we're really focusing on understanding through our occupational therapy, are we changing the brain? We know that children are improving, but what is it that we are changing in the brain? So we're doing EEG before OT and EEG after OT, and we're seeing if children who receive more attention training compared to children who don't receive attention training, are there differences in EEG because of this attention training? So do children who receive attention training have better automatic processing after OT? So now coming back to this slide on translational research, this next current step in the research, taking some of the research from the masters and PhD and really looking at attention interventions in autism, where do you think that lies on this translational research spectrum? So Shreya, if you can relaunch the poll.
Yes. The poll is available for everyone to put in your preferences.
So we're really looking at now how attention training. So our research question now is just attention training improves sensory processing in autism. So we are looking at occupational therapy sessions and we are looking at EEG pre and post. So I'll let you think about that for a little bit. Okay, so 5 more seconds. So again, yeah, most of you said now we are moving to the translation to clinical practice. So that's right. Through these, through this research, I hope you're able to see how we've gone from something a little more basic to a little more translational. Um, and the long-term goal of my research is to be able to identify interventions that are most effective for children with autism. Now, autism is again one condition don't know there's no one cure for autism. There are a lot of different interventions for autism that help manage the condition, but so far, we haven't identified a cure for autism. We know that there are genetics involved in the cause of autism, but we don't know if there is one specific factor that causes autism. And so the long-term goal as an OT and as someone who does neuroscience research is to identify interventions that are most effective for children with autism and help these children with autism process information, pay attention, and really function more effectively in society. And we're using neuroscience, EEG, to guide our clinical practice. So we're trying to identify what is happening in the brain, what that really tells us about how the child is processing information. So this really told us that the focus should not be so much on sensory processing as it should be on attention. And so now we're taking that research to clinical practice. We are you know, developing clinical trials to really focus on attention and see how that results in change. And so there are different things OTs do, but attention training is something that can be a fundamental aspect or fundamental strategy across different kinds of interventions for autism. So you can use that in play, you can use that, you're doing different kinds of schoolwork, you're able to improve attention in different activities. And so the long-term goal is to identify these different interventions, use neuroscience principles to guide this translational research. Okay, so that was a little bit about my research. So I just want to take a few minutes to um, talk about some tips and tricks for career in neuroscience. I think the first important thing is to have a passion for research, especially in neuroscience research. You need to do a PhD, and you need to, most often, right now at least, you need to have a postdoc. Um, you need to get a lot of training before you can start independent research. So you really need to have a passion for research because it takes a lot of training. And if you are not interested in the topic you're studying, it can seem like work. But if you're really passionate about what you're studying, if you're really passionate about the clinical problem you're solving, you are able to really problem solve and stick with that research even when things are not going your way. Another advice is find a variety of mentors. Very often we think of mentors as being someone very senior in the field, and that is good. You need to identify people who have more experience, but a mentor can be someone who's also just graduated and is looking out for you. You can have a variety of mentors, so you can have academic mentors, research mentors, more personal mentors, people who are interested and invested in your long-term goal. Um, and in addition to finding mentors who are successful, people who have good research, good funding, a lot of publications, it's important to identify mentors who are also kind and who are really invested in your growth as well. And the way to do that, way to identify kind mentors is by talking to students of those mentors and seeing how that experience has been. Another advice is volunteer at research labs early and frequently. I was lucky that during my bachelor's in CMC fellow, I got to participate in research early, and so it's very important to get that experience early on. Nowadays, we have high school students volunteering at our research labs, um, and so make sure that you volunteer. And the best way to do that is to reach out to researchers. So don't hesitate to reach out to people, um, and ask them if they have openings in their lab, ask them if you can volunteer, but also don't hesitate to reach out to international researchers. Um, If you are reading a research article that's really interesting, but you cannot access the full text, reach out to the corresponding author. The research publication usually lists out the corresponding author's email. Don't hesitate to send them an email. You might not receive an email or a reply in the first email, but you can send 2, 3 emails. You may never know how you are able to connect. When I was in CMC Fellow, I knew I wanted to do neuroscience research, but that is a rather off-beaten path for someone who is a therapist. And so I did a lot of looking around to find somebody who was both an OT and a neuroscientist, and I found my PhD mentor. And it took 5 or 6 emails to finally connect with her. But once we connected, I was able to identify her as a mentor and come to Colorado State for my master's and my PhD. And that was because I reached out to people I thought were out of my league at that point when I was still in my undergraduate career. It's important to have a long-term career goal, but remember to be flexible, especially with research and with neuroscience research. You may find yourself doing basic clinical research and you really want to work with children. But that you can move through the steps. You have to be persistent with your research. You have to be persistent with um, your passion, and then you will be able to get to your long-term career goal. Sometimes things might change. When I started off as a therapist in my undergrad, I didn't know I would be one day doing independent research in this area, but I always knew I wanted to work for and work with children with disabilities. And career has been shaped a little bit by all the experiences that you get through your career, and so be flexible to some of those opportunities that arise as you go along. Be persistent. It takes a lot of training. One of the reasons I didn't get into medical school is because I didn't want to study so much. And then, after getting a PhD and 3 years of postdoc, I feel like I've studied more than I had anticipated. Um, so, and being persistent with my passion for research has really helped me so far. And so these are just some tips and tricks. I also found that there are a lot of websites online that help you connect with mentors. When you are still in school or in college, you are able to connect with international researchers. If you, um, the Facebook has a lot of neuroscience groups where you're able to identify mentors. Social media, even if you look online, there is a lot of networks that help you connect with international researchers. This platform is one of them. So if you want to connect with me, please send me an email. This is my personal email. And I'm happy to take any questions right now.
Thank you so much for that wonderful talk. It was really interesting for me, especially because this was my area as well. That's psychology and neuroscience, and specializing in EEG as well with ADHD. That was pretty interesting.
Oh, lovely.
I was I was personally interested with the paradigm that was used. It was because generally what we look at is with ADHD, people talk about neurofeedback for improving attention, and so this paradigm was pretty different and interesting. So we have one question by Akshay, but before that, I would be really happy if you could take my question, which was
Yes, yes.
uh, about basically neurofeedback, how it's doing in the field of attention and improving attention with children with ADHD, autism spectrum disorder as well, um, and how do we see it basically? Do we see it as a promising area, or do you have suggestions of where attention research could go?
I think Eurofeedback is a great tool, a great strategy to use. Sometimes children with autism who have more issues, they need some more training, fundamental training before they can reach neurofeedback. What neurofeedback really does is it and there's research using EEG when there are sensors, and so a child is solving a problem, and the more the child focuses their attention on that problem, your brain processing changes. So you go from more disorganized gamma processing to more organized beta processing. So the computer can pick that up real time, and it gives you clues if you're processing better, if you're processing more, if you're focusing more, if you're paying more attention, it changes real time the problem. And so that's some good feedback to get for the child, that they can see how what they're doing at that very moment is changing things on the screen. There's also this paradigm where if you focus, there's a ball that moves up and down, and the more relaxed you are, the more the ball will move, or things like that. And so EEG is a really good tool to provide neurofeedback. I haven't personally used neurofeedback in therapy using EEG yet, but I think that's definitely an area. What my goal is, or what we are looking at, is helping therapists have the child pay attention to the sensory information they're getting. So when therapists are swinging a child on a swing, instead of just swinging the child for the sake of receiving that swinging sensation, if they can have the child throw a ball or catch a ball at the same time, the child is not thinking about his movement. And so what we found in the research is when the attention networks are active in the brain, sensory processing is more efficient. So instead of just doing therapy on the child or having the child just jump on a trampoline without really thinking about it, if there is a cognitive aspect to that thinking, there'll be more efficient processing, because those attention networks, which are otherwise not active, they come on. Does that make sense?
Yeah, it kind of makes sense. As in, I could say in one way that we're targeting the attention muscle of the
Brain,
child.
yeah. Yeah.
Yes, we're trying to train it. Yes.
Yeah.
All right. Thank you. So we have a question by Akshay. He asks, how long does it take for a particular effective rehabilitation strategy to actually be practiced in a clinical setting?
I think that's a very good question. It takes years and years of research for something that comes out to become evidence-based statement. Um, just like the coronavirus vaccine, now everyone realizes how much time it takes, how many years it takes, and how this rushed process is working. But this research started with my master's back in 2013. 7 years later, we just started the very first clinic. We haven't really started a clinical trial, but we started this trial when we're looking at existing attention interventions in autism. Now we will identify what strategies work best, and then we will do a clinical trial. And after doing multiple clinical trials, we'll be able to present that evidence to the field of OT and say that now this should be standard practice. So it takes a lot of years of research. The more researchers that are simultaneously doing this research, it makes it more effective instead of just one person. Right now, not the whole field, but a lot of autism researchers are really focusing on attention. They've moved from these more language and social communication issues to understanding these fundamental issues. So there's a global network of researchers that are working on the same problem, and hopefully that will allow us to make this practice, translational research, more effective. But the thing is, it's not a linear process, and it takes a lot of time. Yeah, that's why I said be persistent.
Yes, it is a rigorous process. And that leads actually to our next question, which is it's a little general, which is, what are the points of intersection between computer science and neuroscience from a research point of view?
So that's a great question. I actually was very fortunate to work with computer scientists, in different areas. We collaborate with so many different people, but one application is brain-computer interface, and I didn't talk about it today, but we also did EEG research So we use brain-computer interfaces. So the computer science scientists developed this program wherein they read people's EEG real time, and that helped people who were very severely disabled, who were not able to move their hands and legs, not able to speak, and only people who were even not able to make eye contact. Uh, and these are people who are just emerging, different different levels of brain injuries, and the computer scientists helped us develop these brain-computer interface algorithms using neural networks, wherein they were able to classify what the where the person was paying attention to, depending on their eye gaze and their level of EEG activity. So they had a screen with flashing letters, and every time the participant focused on a single kind of letter, the computer was able to pick that up, and they were able to spell words. And so we did this research in people's homes, um, and so that is one way we can bridge that gap between something more basic, more mathematical and everyday practice. A lot of signal processing in EEG and in neuroscience research, so in neuroimaging research like functional MRI scanning, diffuser tensor imaging scanning, all of that uses computer science principles because all of it requires signal processing. Now, as a therapist, I am not trained in signal processing, but I'm trained in the application of taking that research data to clinical practice. But I need a computer scientist to be able to help me with my signal processing. So, we have research assistants who are computer scientists who help with taking all of this data and making sense of it for someone who's more clinical. And that's what I wanted to, one thing I wanted to say is neuroscience is such a diverse field that your initial background doesn't really limit the potential of using neuroscience as a tool. You can, do signal processing, or you can use it in clinical trials. There is a lot of scope to use different kinds of skills and use neuroscience as a tool.
Yes, ma'am. I really, really agree with what you said right now. We have Yashi Jain, who is a biotechnician, and he recently switched from basically his field to neuroscience, and wants to know if you have any tips and suggestions on how they could move further into neuroscience.
I think the best place to start is identifying what your passion is and what your clinical problem is. So, are you interested in working with adults with Alzheimer's? Are you interested in working, or are you interested in identifying why people do what they do when they're angry? What is that clinical problem that interests you and excites you and you're passionate about? Once you identify that, you I think the next thing would be to read research papers around that. Google Scholar, PubMed are very easy sources to find papers. So my clinical problem was sensory processing in autism. So I would just Google search sensory processing autism neuroscience, something very simple like that, and identify research papers that I would think that oh yeah, this is a good way to solve this problem. This is a good way to answer this problem, and then reach out to those researchers. See if there are, if you're already a biotechnician and you already have skills that you can use, you can, and you don't want to study more, you can just directly, start as a research assistant, and start getting involved in that research. If you want to get more training, then you would need to identify a PhD mentor who's able to use your skills and who you can show that why your skills as a biotechnician can help their lab as well. So I think the first thing is to identify what clinical problem you're interested in. And you may think, oh, I'm interested in so many different things. But as you start reading research papers, you will know what is more interesting to you and what you want to spend your life doing. If you are if you're not confident that you can spend your entire life doing this research, I wouldn't suggest going for it, because research is a lot of hard work, And you have a lot of small failures along the way, which then eventually lead you to answering your question. But every time you solve a complete a study, it generates more research questions than it answers research, gives you answers. And so this should be something that you're passionate about, and you want to spend your whole life answering that question. um, so that would be one way to narrow where you want to start.
Thank you, Dr. Crasta. That was. I'm pretty sure the attendee was. Yeah, we have a response in saying thank you. Uh, Ma'am, I have one question for you regarding EEG, which is, yes, it's a fantastic tool to study brain waves, but it comes with a lot of limitations, especially studying children with autism or, special children. Basically, we do have like a lot of movement artifacts that we deal with. We have limitations about like the number of electrodes we can use to reduce the noise as well. So, what are the challenges that you have personally faced doing using EEG as a tool in your study?
That's a great question. Firstly, I want to say, like, compared to some of the other neuroimaging tools like an fMRI, which the child, is inside a scanner, children with autism, it's really hard for them to be in a closed space with that loud sound. So compared to that, I would say EEG is more feasible for children with autism because you can put the cap on, you can have something to distract them. We've used a lot of strategies. We're using a really high-end EEG cap, which what it does is it amplifies the signal right at the sensor instead of amplifying at the where the wires meet the amplifier. And so some systems, what they do is they collect the signal and then it passes through the wires and then it gets amplified later on. But then if there's movement artifact anywhere, that noise gets exaggerated as well. But if you're collecting right at the scalp, um, after when there's movement artifact, both of them get exaggerated. The signal and the noise get exaggerated at the same level, so you're able to pass it out. But again, here I would say some of the computer science principles of really looking at signal processing and identifying that signal to noise ratio. That's um, that's where that would come in. We all, as a therapist, we also have some strategies to help the children stay as still as possible. What we do is we do a artifact training before the session starts. So we show children their brain waves, real-time brain waves, and we ask them to blink, blink, blink. And we see that, muscle activity changes how the screen looks. And so we tell the children, we are really interested in identifying how your brain is working, and we are not interested in looking at how your muscles are working. So we want you to help us understand what your brain is doing. And so we want you to stay as still as possible. And then we collect 5 minutes of data. We give them another, 2 minutes of movement break, where we're really asking them to jump and move their hands and shake their leg, get all the wiggles out. And then again, we have a 5 to 10 minute of focus attention task. These strategies help the children remain more still and focused on the task. So we're really able to get that good data. We also have some fidget toys, especially for autism and ADHD. These children need something in their hand or something in their feet. And so to keep their head as still as possible, we position them really nicely, and we also have things in their hands which they can fidget with. So that helps them stay more calm. So these are some of the strategies we use to collect good data. But so far, we've always had we've had pretty good success. And sometimes we need to roll on the floor with the child during the break, but that allows us, us to have the child sit then for the next 10 minutes more still, and that gives us good data. So as researchers, sometimes we really need to understand what the children need. Yeah.
Yeah, yes. Thank you. That was a really wonderful explanation. I can really imagine how that would be like, and where basically a therapist comes in and where a computer science major comes in in trying to do the study. Yes.
Yeah.
Thank Yes. Thank you so much, ma'am, for joining in with us. I think we were really. I mean, I was blown away with your presentation, and also your tips were really helpful to all these attendees over here. We would also be having a career panel discussion maybe on the 29th. So we would encourage all the attendees as well to join in and probably even discuss more about how we can grow in the area of neurosciences and develop our path in research.
Yeah, definitely. Thank you for this opportunity to talk to all of you, and thank you for your very interesting questions.
Okay. Thank you so much, ma'am.